My name is Dr. Joe Fontenot. I'm from Mobile, Alabama, and I'm with the Vision Rehabilitation Committee of the American Academy of Ophthalmology.
Hi, Dr. Fontenot. Tell us about the Vision Rehabilitation Committee and some of the things that were presented here at AAO.
Well, as always, it's a pleasure to come to the American Academy of Ophthalmology meeting. There's so much available in every field in ophthalmology, and particularly in low vision. You have exhibitors in the exhibition hall who can demonstrate various aids and devices, magnifiers, new electronic devices, and all of the technology that's available is here. Now, in the meeting halls at the talks, there's information about very basic things involved in low vision rehabilitation, about the psychological aspects of vision loss, about communicating with patients who have vision loss, and generally about how to help the patient who has low vision. There's quite a bit involved in this, beginning with the simple referral of the patient by the ophthalmologist to some facility that can help the patient, whether it's a low vision clinic, whether it's state or federal services, the Veterans Administration, or many of the myriad of companies that can help people who have impaired vision. So there's a lot here, and it's a sort of a synopsis or a joining of all of the different doctors, organizations, and everybody involved in the care of the patient with low vision.
What are some of the things being done to address the psychological aspects of losing vision?
Well, many of them are very simple. For instance, people who have macular degeneration are always afraid of completely losing their vision, becoming totally blind. So that's very rare in people who have macular degeneration. Generally, they have central vision loss, which does tend to progress, but it's extremely rare to involve the entire eye and have a patient who is totally blind. So we always tell the patient this, and a lot of them are greatly relieved just by being told that it's unlikely they will end up with total blindness, not being able to see any light and to need a guide dog and a white tip cane, that sort of thing. So there's a lot of other things that they're afraid of, things that they're reluctant to do, and simply discussing these things with them often gives them considerable relief and enables them to be more active and less fearful. Now, with the aids and devices, if you show them what's available and what can be done, it does provide hope. And hope, of course, is very important. There was a French philosopher named Guy de la Rochefoucauld who said that hope was an ineffable essence without which man could not live. So we understand that, and we try and provide hope for these people who have vision loss.
What are some of the new technologies that have been featured this year and the pros and cons of them?
Well, the thing that's being talked about quite a bit in the press and TV and whatnot are the head-mounted devices. Now, there's about almost a dozen of these head-mounted devices, varying from ones that cover only one eye to ones that fully cover the face almost. And these devices do provide considerable technical help in seeing small things like trying to read a newspaper or use a computer, looking at a keyboard, all those sort of things. They are getting better and better, and as I said, there are more of them available. They are expensive. They have come down in price a bit, but they're still in the thousands of dollars range, and they're not for everybody. It's important that the person be evaluated by a low vision specialist and decide whether they're a candidate for these sort of devices or not. So some people have relatively mild vision loss and do not need or benefit from these devices. Others who have severe vision loss might be more likely to benefit. But again, it varies considerably from patient to patient, depending upon their needs, what their goals are, their technical abilities. And so it's not something that a person should just go out and buy without full low vision evaluation and recommendations by a low vision specialist.
How can patients find a low vision specialist and resources in their area?
To find a low vision specialist in your area, the first thing to do is to ask your own ophthalmologist. Usually they will know who is available locally and who is the best person or organization for you to see. That's the first thing. You can then also look up online. You'll find a bunch of organizations and devices. Also, you can check with your state agencies. All states, all 50 states, have low vision agencies which are federally as well as state funded. So there is a low vision agency or person involved in low vision care in every state in the union. Now it varies, of course, according to your location. Particularly rural areas very commonly do not have a low vision specialist, but even just one simple visit to a low vision specialist in some area a little away from your home is worth it. So everybody who develops low vision should be evaluated at least once by a certified low vision specialist, a low vision doctor, some low vision professional, before going out and just buying devices at the Walmart or from Amazon or whatever.
When is the best time for a patient to start looking for a low vision device and learn to use it?
The best time to start looking for low vision devices is early. The earlier you seek help, the easier it is to learn and continue to be fully active and functional. You don't want to wait until you've not been able to read for, say, a year or 2 or 3. At that point, you've lost the real window of opportunity. So you want to do it early, before you lose the ability to stop reading, to stop using your computer, to do the things that you want to do or need to do. The answer is early.
Have there been any new techniques for evaluating or treating low vision patients presented here at AAO this year?
The main thing that's been presented at this meeting in 2019 is the plethora of aids and devices that are available, and also the need for psychological counseling for people who have impaired vision. The fact that many of them are depressed, many of them do not seek aid early, has all been presented and discussed. The video that we have developed, which says there is something else you can do, which is led off by a discussion from Dr. David Park, who's the CEO of the American Academy of Ophthalmology, has been shown at many of the sessions here. This emphasizes to the ophthalmologist that low vision care is a part of routine ophthalmology care. It's something that should be presented early and often, and it's the duty of the ophthalmologist to provide information, referral, and resources to the patient who develops low vision.
Is there anything you'd like to add in closing?
I would like to add that we want to see the trend of having the ophthalmologist, the general ophthalmologist, more aware of the need of the low vision patient to have psychological as well as technical counseling. Not only presenting them with devices, but also to give them psychological support.
This is very helpful information. Thank you, Dr. Fontenot, for joining us.